say the patients inspire me the most, because when I see them and see what they're going through every day, it makes me feel better about things I go through. And even if you think you're having a hard day at work, and then you see what they have to deal with and the things they have to go through, especially with our team, it just really makes you appreciate and inspires you to do better, because they're doing their best. I feel that vessel preservation is a very big, important topic that doesn't get discussed enough, because I think people take it for granted, and people will often think you're always going to get an IV in, you're always going to be able to get a line in, and that's just not the case. And I think that sometimes people take that for granted, and they don't appreciate when they do have good health and good vessel health. They don't appreciate that, and they don't appreciate that one day they may not be able to get that access, and then that's going to be a bad day for them, and they're going to have to figure out the next steps and next plan, and that can be hard. I am a very firm believer in education. Obviously have my master's in nursing education. That's the majority of my role, and I think that when you stop learning, I think it's really bad for you and for your job. I think that you get in a rut, or you get stuck, and you don't continually improve, because you're just sitting there doing the same thing you've always done, and maybe it's not working, and you just continue to do it. And I think that's when you start to dislike your job, and you start to really feel not happy in your job. And I want to be happy in my job. So I'm continually trying to learn new things, try new products, anything that can not only make it better for the patient, but we also want to make our job easier, of course. And we want to do things that are going to improve care for the patient, but we also spend time learning new things that can make our process better, make our flow better, make our lines stay in. Just any technique where you are making good choices and using different guidelines that help you decide what's the best vessel even to use, just starting there, starting from the very beginning, and starting with where's the best place to start, where do we go from here, what happens once you start having issues, and the products that you use to make everything better for the patient.